The initiatives of continuing education are to mainstream disabled population and children with special needs, told Dr. Nagendra Swami, Principal Advisor of South Zone Board of Continuing Education at a meeting held at Trichy. Dr. T. Nagendra Swami, a social scientist, Hyderabad, the Principal Advisor of the Southern Zone Board of Continuing Education and Chairman of Villagers in Partnership, said the initiatives of the continuing education are to the mainstream disabled population and the children with special needs. While chatting with the special educators for disabled children, Dr. T. Nagendra Swami visited the 10 days medical camp organized by SEVAI, a Trichy-based NGO in collaboration with Equal Health Australia in Trichy District Welfare Committee premises. 67 special educators and 7 psychotherapists of SEVAI helped 19 members of Australian medical team for reaching around 1,500 patients a day, mostly disabled elderly women and children with muscular dystrophy. Winding up the third day of the medical camp, the Principal Advisor of the South Zone Board of Continuing Education had a chatting with the organizers of Inclusive Education for Disabled, the differently abled and the children in need. The NGOs are to come forward and reframe their committee for empowering the vulnerable in the communicative literacy, communicative awareness and cooperative functionality.
We are all aware of Professor Malcolm Adiseshaya, who was a pioneer in the field of adult and continuing education and was also the founder of the Tamil Nadu Board of Continuing Education several decades ago. Unfortunately, this idea has not seen daylight in any other districts or other states except in the state of Tamil Nadu. And it is now being planned together with the present chairman, Mr. K. Govindaraju, who is heading the Tamil Nadu Board of Continuing Education, to look at the possibility of setting up a southern region Board of Continuing Education. With the things changing as they are, we're all aware and concerned about how people are being benefited by education, and in particular the continuing education, which is more unfortunately still looked upon as means of gaining livelihood rather than means of very effective and important tool of addressing their day-to-day problems more at the village level, at the community level, and even at the group level. And in this sense, we feel that a southern regional effort to combine the good experiences of different states in the under different headings of the continuing adult education over the last few decades, whether we cannot come up with a more practical and a more accessible tool for individuals and groups in the current day situation, where I think the communications channels are increasing, the gaps are reducing, but the opportunities are still not visible for people in this direction. So in that sense, I think an effort bringing the southern region states together and to bring in important people with vast experience and understanding in depth of what the value of continuing adult education can bring to village communities in really ensuring that they participate better in their own governance and are able to resolve a number of issues and problems at the local level.
At Kalayarangam premises, District Welfare Committee System SEVAI, its Director Dr. K. Govindaraju inaugurated this medical camp for a duration of 7 days. A 19-member medical team, Equal Health Australia, and 12 SEVAI paramedical staff and general medicine including neurology, cardiology, dialectology, gynecology, pediatric, eye care, physiotherapists, dietitians, dental care, etc. render their medical and health services to mostly needed population of Tiruchirappalli. For those in the age group of above 40 and among others based in the recommendations, blood sugar tests were conducted free of cost. free medicines for 332 patients, free glasses for 122 patients were provided, and dental care, dietitian counseling for diabetes, obesity have also been given to the needy patients. Special physiotherapy exercises have also been given to the musculoskeletal dystrophy affected. Dr. Paul Clark and his team is very committed for the cause of the poor and needy. For all those who attend the medical camp, the prescribed medicines were given free of cost. Around 2,000 people benefited out of this 7-day-long medical camp, in which many of them were women, children and elderly people. The team members of Equal Health are simple and they prefer staying in Amar village in simple cottages, taking simple food and visit neighborhoods too. SEVAI is a city-based organization working for the development of poor and needy in a comprehensive approach. Mr. Paul Clark from the Equal Health mentioned that individual health and hygiene is largely dependent upon the adequate availability of drinking water and proper sanitation.